Now, the COVID surge in national capital Delhi, of course, has led to immediate restrictions. Announcements coming in from the Delhi Disaster Management Authority. And one of those immediate restriction is, again, on the restaurants. Remember, this sudden announcement coming in, one, on the private offices that have been shut, which means all private office employees will have to go back and work from home yet again. But also, restaurant owners have been told that the dine-in is not going to be applicable anymore. Only takeaway will be allowed. So what exactly has happened? It's a complete ban on dining at restaurants, and private offices have been shut. Only work from home will be mandatory. If you do want to enjoy the restaurant food, then takeaway and home delivery by the restaurants will be allowed. So you can take away your food from the restaurant you like. Shops inside malls and marketplaces, however, are operating for now on an odd-even basis between 10 a.m. and 8 p.m. But even if you decide to go out, if you want to venture out at all, the markets are working only on a odd-even permit, which means only one weekly market will be allowed per zone. So with these new restrictions, weekend curfew will continue in Delhi. Delhi Chief Minister Arvind Kejriwal announcing special yoga classes if you are a COVID positive patient and under home isolation.
जो लोग होम आइसोलेशन में इस टाइम हैं, उनके लिए स्पेशल योगा के और प्राणायाम के कुछ क्लासेस हम लोग शुरू कर रहे हैं, ऑनलाइन क्लासेस। वो अपने घर बैठे हमारे इंस्ट्रक्टर के साथ योग कर पाएंगे। इसके लिए हमने पूरी तैयारी कर ली है। इंस्ट्रक्टर्स की एक बहुत बड़ी टीम तैयार की गई है, जिनको स्पेशल कोरोना से संबंधित कौन कौन से आसन हैं, कोरोना से संबंधित कौन कौन से प्राणायाम हैं, इनकी ट्रेनिंग, स्पेशल ट्रेनिंग दी गई है इन सभी इंस्ट्रक्टर्स को। पिछली वेव के मुकाबले में ये वेव बहुत माइल्ड है। ये ऊपर वाले का शुक्र है कि हम लोग सब एक बहुत माइल्ड वेव से डील कर रहे हैं, नहीं तो दूसरी जो अप्रैल में वेव आई थी वो बहुत ज़्यादा खतरनाक थी। इस वक्त जैसे 136 मरीज़ ओमिक्रॉन कोरोना के यहाँ पे अभी भर्ती हैं। 136 में से केवल 6 पेशेंट्स ऐसे हैं जो कोरोना के इलाज के लिए आए थे। बाकी 136 में से 130 पेशेंट्स ऐसे हैं जिनमें इंसिडेंटली कोरोना निकला। वो किसी और बीमारी के लिए आए थे लेकिन इंसिडेंटली कोरोना निकला।
देखिए, नंबर तो बढ़ते जा रहे हैं। अगर आप पिछले 8-9 दिन से ही देखें तो ऑलमोस्ट 4-5 टाइम्स हो गए हैं। कहाँ 200-300 जैसे दिल्ली में शुरू हुए थे, कहाँ 20,000 क्रॉस कर चुके हैं। जिस तरह से नंबर बढ़ रहे हैं तो ऑलमोस्ट एक पीक आने वाली है जनवरी में। और मैं आशा करता हूँ जैसे जो साउथ अफ्रीका में हुआ था इस पर्टिकुलर स्ट्रेन में, सीधा ऊपर गई थी और सीधा ही नीचे आई थी। तो मैं बहुत उम्मीद करता हूँ कि जिस तरह से अनफॉर्चुनेटली ऊपर गई है, आई होप फॉर्चुनेटली वो नीचे भी आए और सडन फॉल भी हो, स्टीप हो।
So, of course, most restaurant owners specifically are fearful of business losses, and almost for 3 years in a row, they do not seem very happy. Listen in now to what the topmost restaurant owners in Delhi specifically have to say. Listen in.
How do you seek off these restrictions with either a full shutdown or a cap on the capacity of the functioning of restaurants?
As you know, we've been obviously functioning with 50% occupancy the entire sort of financial year, and have been under weekend curfew and the night curfews. So, for what I'm not understanding is that, you got a few different things that are happening. One, we are focusing on vaccination, so staff is all vaccinated. You seek customers entry, you give entry to customers that are vaccinated. And now you're shutting down the industry by closing down Delhi, which for us, it makes no sense, because you're anyway sort of restricted with your timings. You have 50% occupancy, your staff is vaccinated, your customers are vaccinated. So by shutting it down, what are we going to achieve? It's only going to lead to unemployment and more disruption to business, revenue loss for businesses, tax loss for the government. And ultimately, who suffers is the consumer. They don't have the ability to eat out, A, And every business is not built for delivery. There are many businesses that can deliver, but every business has different sort of angles to it. Bars in general obviously do not deliver. There's many cuisines that it's very hard to deliver those cuisines, and the infrastructure is also not there for many. So it's a very difficult situation we find ourselves in.
Hotels still were suffering because unless and until travel really starts, there will be no business in the hotels. In the first COVID wave, the performance went to 1 to 3%. Obviously, everything was shut down. The second COVID wave, it came down to about 11 to 15%. Situation is really grim. We have to realize that this is the only sector which has been hit badly. I mean, of course, all of them have been hit badly. This is the worst.
There you heard it. Kabir Suri is one of the big names and also runs the Mama Go To restaurant. And of course, that is going to be reflected in what many other restaurant owners have to say. Let's go across on the ground. My colleague Mohit Sharma with all the latest. Mohit, what are you picking up from the ground? Of course, because the numbers are increasing, there is a worry. The government, therefore, that is the reason, has imposed these restrictions. But will it not impact the business, the economy of the city of Delhi and in fact nearby areas?
Well, absolutely, Pooja. It is bound to impact, especially the restaurants and, the hotel industry, really. And that's something that we've also heard in the various voices that have also come forward. And more importantly, this is an industry that has been very hard hit over the past 1.5 to 2 years, ever since, COVID first was reported here in India. Every lockdown that has been imposed, every kind of restriction that has been imposed has been very hard on the restaurant industry. And that's something that has been once again being voiced by the industry as well. We are currently standing in Bengali market, a very posh sort of a market in central Delhi, and we'll just get you through these visuals as well so that you better understand as to what exactly is going on, because this market usually attracts a whole lot of people coming in here, not just the national ones but international as well. And we'll just pan out and show you as to what exactly is the kind of response from the people here as well. You have a whole lot of people coming in here, but most of them are traveling in their own cars. You'd find a single individual, a single occupant coming in one car. And secondly, from the side of the administration as well, you have the paramilitary that has also been deployed. And the idea is that in case there is any sort of gathering that takes place, or there is large number of floutation when it comes to COVID protocols that are happening, action can be taken with immediate effect. So that is the reason why there has been deployment. Now, coming back to the topic of how the industry has been hit. Of course, the industry has been arguing that there are several of the restaurants which do not have the facility of delivery, and hence they are bound to be impacted by it. But of course,
Mohit, what you're showing is very interesting. It doesn't look like that the market is really any less crowded. People are coming in. So two quick questions here. One, are people also following guidelines? Do they realize that they must go out to dine in only if it is absolutely necessary? Otherwise, they need to be at least sitting at home. And importantly, do you think restaurants, at least at this point, are getting those takeaway delivery orders and they are following protocols in that as well, Mohit?
Well, see, Pooja, there's from the side of the customer, they are very clear that some of them, who live in the nearby vicinity would want to come out and rather take away their orders. And that's precisely something that is happening right now as well. You have, a whole lot of individuals coming in their own vehicles, taking their orders away. But at the same time, they are exposing themselves as well. On the other hand, from the side of the restaurants, they really bank upon customers coming in and dining in the areas. And that's precisely what they've been saying, that if the DDMA really wanted to come out and bring about stricter measures, they could have just gone ahead with ensuring that the seating capacity could have been lessened, or for that matter, social distancing could be followed. And if something like that is not followed, action could be taken against those individual restaurants. But right now, they are furious of the fact that ultimately it's only the restaurants which really have to bear the brunt of it. On the other hand, you have the government, which is very clear cut, saying that if they allow gatherings to happen, it will only extend the surge to a magnitude that it could be very difficult to contain. And by the kind of numbers that are flowing in on a daily basis, it becomes really difficult for the government to not implement these measures. And that's precisely why you have, not just the central leadership, but the state leaderships as well. In Delhi as well, you have the CM himself coming out and asking people to stay indoors and not step out if not necessary. And more importantly, these measures that have been implemented is because of the sheer fact that people initially flouted these norms, resulting in such a surge in COVID numbers.
Mohit, keep tracking all the latest on what's been happening on the ground, because it is, of course, while some of that anger may be justified by restaurant owners, how are public and how are some of the restaurant owners also following protocol in their respective areas? That remains to be seen. Thank you so much, Mohit Sharma, with that ground update. So if you are a Delhi resident, if you're a Mumbai resident or Bengaluru, what are the curbs in your city? Are they same? What is that you must know? Here are the details. Let's begin with national capital Delhi. Now in Delhi, remember, at this point, the big news coming in is that the restaurants have been shut, and also that bars will also be shut, but there is takeaway allowed. Of course, gymnasiums, salons also are facing restrictions at that point. Let's go across now to the financial city of Mumbai. Malls, restaurants, allowed to function, but only with a 50% capacity. And only that if you are vaccinated. If you have both your doses of vaccinations, you are then allowed to be visiting some of these malls and restaurants. What about? Let's go across to the southern state of Tamil Nadu. In Chennai, restaurants are being again allowed to function with 50% capacity in Chennai. And the curbs then come again on Bengaluru in the state of Karnataka, where weekday allowed to function with 50% capacity, and on weekends only takeaway will be allowed. So if you notice clearly, it is only the national capital Delhi that has primarily put restrictions on restaurants and bars, which are completely shut, only takeaway and delivery allowed, while both Mumbai, importantly Chennai and Bengaluru, have at least to some level let the restaurants open, despite of course COVID surge also being reported from these cities. So, of course, when we talk about the COVID surge, one specific concern and worry, you ask any young parent and they'll tell you, is it about their child who is still unvaccinated? Could they catch the COVID-19 virus, and specifically with Omicron spreading fast and wide? There is data coming in from the United States of America, then there is data coming in from within India as well. What does that data say? Take a look at this special report.
With the rise in Omicron variant cases in India, more children are being hospitalized. According to sources in the Indian Academy of Pediatrics, 31 children are hospitalized in Delhi, all below 15 years. 9 are admitted in private hospitals. Most have existing comorbidities apart from COVID-19. Symptoms include high fever and throat pain. Those admitted report breathing difficulty with high fever. 8 children reported seizures, 2 have low blood pressure. Sources at Delhi's Chacha Nehru Bal Chikitsalaya, a prominent child specialty government hospital, said 2 children aged less than 2 years were admitted as COVID patients, and daily 4 to 5 pediatric cases are coming to OPD. Hospitalization documents accessed by India Today reveal that at one government children's hospital, children below 5 years also had to be hospitalized. Doctors, however, assure that hospital stay is brief and results in quick recovery. They say hospital admission numbers are not high and advise caution.
A few patients, they admitted because of the difficulty in breathing. Mostly it is because of the involvement of this infection of this voice box, what we call the laryngotrachobronchitis group in the medical term. And they also recovered with like simple treatment like nebulization with some medications. And they also get home quickly discharged from the hospital in 2 to 3 days. But most of the time we are treating on the OPD basis or doing some video consultation.
Special arrangements for parents and child to stay together have been made at Madhukar Rainbow Hospital, so families feel no cause of concern about child safety. In Karnataka, where numbers are surging, doctors say most cases are treated at the OPD level.
In the OPD, I have seen about 15 children. All of them have been safely managed at home. Most of them are already entering into their second week and doing well. The common symptoms we see, just like any other viral infection, in fact, like in the first and the second wave, is fever. Ours being a referral center, we have admitted 5 children with COVID. Now, the reason for admission is not because they had severe illness, but because the COVID was associated with other problems, which could have come with any other infection.
Parents are worried as global data suggests surge in child hospitalizations.
He went for his first jab and he went to the vaccination center nearby. So the child came back, he was fine and he had a little pain in his arm, which was expected. For 2 days he was fine, and on the on the third day night, he had this high fever, and the next morning we got him tested, the RT-PCR test, and the child came positive. He had a heavy chest, like he was feeling heaviness in his chest and sore throat.
While doctors assure that COVID leads to mild disease among children, the fear is that as the third wave numbers surge, more children might need hospitalization. With Pooja Shali, Milan Sharma, Shushant Mehra in Delhi and Nolan Pinto in Bengaluru, Bureau Report, India Today.